Well, good morning, everyone. Happy to present today on antimicrobial stewardship. I do want to give a shout out and a thank you. Carla Smith at TMF helped me with a few resources putting this together. And if you haven't looked through the TMF website, they have so much information. And I do want to give a thank you to Carla for helping with that. We're talking about antimicrobial stewardship today. And in prep for this, I kind of started interviewing some of my infection control preventionists in some of the nursing homes, and kind of all in agreement. They've kind of told me, well, we've had to kind of put this antibiotic stewardship kind of on the side burner because of COVID. They're getting information from CMS that this is now being ramped back up, you might say, as we hope and pray that the pandemic wanes. So I think this is a timely time to talk about and refresh ourselves on what antimicrobial stewardship is. So let's go to the next slide. The learning objectives we want to talk about are automatic antibiotic stewardship. We want to define that, understand why improving antibiotic use is important, describe the developing resistant issues, review the regulatory requirements, and then we'll segue and talk about the core elements of an antibiotic stewardship program as we hand that off to our QI portion. So we'll jump in to the next slide. Defining antibiotic stewardship. It's the effort to measure and improve how antibiotics are prescribed by clinicians and used by patients. So you even see, even in the definition, you see this kind of a QI concept. We're measuring and we're looking to improve. This is from the CDC. Improving antibiotic prescribing and use is critical to effectively treat infections, protect patients from harms by unnecessary antibiotic use, and combat antibiotic resistance. So it's kind of our statement there. Next slide. And just a reminder why improving antibiotic use is important. And I think unless you go back and read in the history books, we've kind of gotten used to having antibiotics around. We forget what it was like without them. And you know, when you had a serious wound, the risk of sepsis and death was very high. It was really considered a modern miracle, you might say, of science when the early 1900s, all these, penicillins and the sulfas started coming into our attention, and the idea of these antibiotics, we can cure almost anything now, right? This idea that that it was just a breakthrough. If you think about it, I mean, you couldn't really have surgeries, or I mean, we just take it for granted. Maybe you have to have a transplant of some sort. Well, none of that was even on the radar until antibiotics came into the conversation. They say that it even changed the scope of World War II, just in the ability to heal wounds in what was really many times uncurable, now became curable. So it's a dramatic change. The problems that we have are we have a slowing development of new classes of antibiotics, and that's combined with a really important development of resistance that we're seeing to the antibiotics that we have. In fact, the CDC says each year about 2.8 million get an antibiotic resistant infection, and more than 35,000 die every year. We'll go to the next slide. Here's a little cartoon for you. Times have changed. Here's the medical receptionist. Don't forget to take a handful of our complementary antibiotics on your way out. I don't know if anyone has been in practice long enough to remember it was almost like that. I can remember when I came out of college that the concept of stewardship and resistance really wasn't an important thing. We had so many more antibiotics we could just move you to. The conversation of trying to be judicious on how we use them didn't cross our mind. In fact, if you sneezed twice, we probably prescribed you an antibiotic to clear that up, whether you needed it or not. Let's turn to the next slide, please. Times have changed. If you look at just how often we use antibiotics now, it's still an issue, but it's become a problem. This is kind of comparing where we are in Texas to the rest of the United States. In other words, antibiotic prescriptions per 1,000. And you see Texas. So the lighter you go, the better you are about just throwing antibiotics at anything. And the darker you are, the more of a problem you seem to have. And Texas is kind of in the middle, but it's on the bad side of middle. So we certainly in Texas have a need to improve that. Go to the next slide. talking about bacterial resistance, I don't want to get too far into the pharmacology, but it's just helpful to know in general. What we do with antibiotics is we look at kind of the differences between a human cell and or a bacterium that would cause harm. We try to see what differences they are, and we try to take advantage of that. So we can take care of the bad bacteria and not, pardon me, and not harm the natural cells. And we do this through several mechanisms. We will try to inhibit the cell wall synthesis. If you remember your biology, drugs like penicillin. Sorry about that. Inhibit cell wall synthesis. Depolarized cell membranes is another area. You have to have nutrients that come in and out of a cell, and that's inhibited. You can inhibit protein synthesis, inhibit nucleic acid synthesis. This is the be able to create RNA and DNA. So that you think about it, the bacteria.
Teresa, call extension 2012. Teresa, call extension 2012.
Sorry about that. Inhibit the ability. Think about the bacteria. They're wanting to multiply. They're wanting to replicate themselves. So they need this RNA DNA process, and we have antibiotics that would target that area. The main mechanisms of resistance, you can go to the next slide. It's kind of to give you a visual of what this looks like in those same areas. So you start attacking these bacteria and with these antibiotics, and it's surprising and interesting that the bacteria start developing countermeasures, and they respond to and become more resistant. Some of the main mechanisms of resistance are limiting the uptake of a drug into the cell, or modifying the drug target where the antibiotic can attach itself. We've seen some of this with the SARS COVID-19 ideas. There's inactivating of the drug. Beta lactamases are a classic picture of that. We'll talk about that in a minute. And then active drug efflux. In other words, the antibiotic will get into the cell, and how quickly can we jettison it back out of the cell? These are all mechanisms that bacteria develop in order to fight off the onslaught of the antibiotics. That does look like a picture or a scene from Monty Python. Not sure how that got in here, but somehow it did. Let's move on quickly before we focus on that picture. Next slide, please. Increasing antibiotic resistance. So this is just a picture of an example of a very common issue. These are a number of enzymes in a cell that are beta lactamases. Now, these are enzymes the bacteria can produce to really enable or break down some of our most popular antibiotics. We're talking about penicillins, cephalosporins, vancomycins. Look at 1970. Very few enzymes that were able to break down those antibiotics in the cell. But look what's happened in the coming decades. And as we come, this goes up to 2010. This is a dramatic increase in the number of countermeasures, you might say, these new protein and enzymes that in the end, they reduce effectiveness of many of our most popular antibiotics. And we see this happening in just about every class that we have. Next slide. On the other side, look at the pharmaceutical driver. So look at, this is a graph showing the new antibiotic approvals that we've had over the last 30 years. When I came out of school in 1990, right in there, we had all kinds of antibiotic classes and new ones coming out. We had no worries if we couldn't fit you with an antibiotic and it didn't work, well, we'll just grab you another one. Not a lot of concern, but look here in the last 15 to 20 years, gotten somewhat better in the last 5 years, but you see this drop off. And this question is, why is the drop off? And there's a couple of reasons I think that's happening. One is that antibiotics are expensive to develop from the manufacturing side. Also, there are large financial incentives for the manufacturers to work in different areas. An example of cancer therapies. There's a lot of funding you can get through the cancer research for new medications, and we don't really have that. We haven't had that for antibiotics. And the result is we have a reduced number of options growing for bacterial resistance. Next slide, please. So it makes sense that we want to make a focus on how we use antibiotics in long-term care. Take a look and see what things are happening. Antibiotics are very popular in our setting. In the little caption here, up to 70% of nursing home residents receive one or more courses of antibiotics in a year. That's most of our people. And almost everyone is getting antibiotics at some point throughout the year, and probably more than once. Studies show 40 to 75% of prescriptions are unnecessary or inappropriate. In other words, we didn't have the right diagnosis, we didn't use the right antibiotic, or we didn't use the right dose. And so there's an attention on how we can improve that. Overuse, we need to remember, harms the frail elderly. Antibiotics are not benign. They have side effects. They have stomach side effects. They have cognitive side effects. There are several interactions that happen between the antibiotics, not to mention the fact that overuse is producing resistance. And so the more we use antibiotics for the wrong infection, really increasing the risk of developing hard to kill bacteria. So the CDC recommends all facilities work to improve their antibiotic prescribing. Next slide. So I wanted to kind of look at some of the regulatory requirements in long-term care, thinking about the antibiotic stewardship program, just looking at FTAG 881 here. It reminds facilities they need to have a stewardship program that includes, and I've underlined this for you, antibiotic use protocols. In other words, you have to have a plan, and you need a system to monitor antibiotic use. This just screams out QI, right? This is kind of in the definition. The intent of this, it develops and implements a protocol that will ensure residents are prescribed the appropriate antibiotic to reduce the risk of adverse events. And it develops and promotes and implements a facility-wide system that will monitor the use of antibiotics. And so we have a system where we're collecting data, we're feeding back and looking back on itself to see how successful it is. This is just from the regulations. Next slide. So the regulatory goals continue on. This will be accomplished through improving antibiotic prescribing, administration, and management practices so that residents receive, and here's the 4 things to remember: the right antibiotic for the right indication, at the right dose, and for the right duration. So all these are important aspects of trying to limit side effects and try to avoid antibiotic resistance. Making sure that you're getting the right antibiotic means getting lab results and knowing what's sensitive and what's not when it's available. And do you really have the right indication? Do you really have an infection? This is part of what you'll be looking at to see if you really need an antibiotic or not. Right dose and the right duration. If you're not giving antibiotics prescribed long enough, if they're too short, you're really providing a risk of resistance. And then if you're overusing the antibiotics for no purpose, you're also increasing the risk of developing hard to kill bacteria. Next slide. So Carla sent this to me as well. It's just a really nice checklist. Have you ever been on a test in college and you were able to get the test, a sample test before you went in? Like, this is what the teacher used before. And I have it really helps. Well, this is a CMS surveyor checklist. This is kind of what they're looking for when they walk into our buildings to see how well we're doing on our program. I thought this was very helpful. And they're asking themselves, do they have written use protocols on antibiotic prescribing? So do you have written plan out for indications and dosage and duration? All this should be written out in a plan. Protocols to review the clinical signs and symptoms of lab reports. And what assessment tools are you using? It mentions the SBAR tool for UTIs. McGreer's is another common tool that's used frequently. A process for periodic review of antibiotic use by prescribing practitioners. They want to know that you're documenting that you have a system where you're going back and periodically checking to see if things are working out correctly. And that's part of the feedback system on antibiotic resistant patterns. using laboratory data and prescribing practices for the prescribing practitioner. They put an emphasis here. The surveyors are really interested in, are we tracking the new people that come into, new residents that come into your home? Maybe they're an old resident that's coming back from a hospital or another facility, and they're bringing other types of infections into your building. They want you to really be keeping a track of that. Next slide. So kind of to turn the corner here, just the core elements of implementing a plan, and Susie will hit more of this, but I just wanted to touch on the fact that it involves all levels of care. There's got to be a leadership commitment for this type of thing, accountability. People need to know who's responsible for making sure the program is working. Drug expertise, you want to utilize your consultant pharmacist and those who've been trained in infection control, and take action. You know, early on, they really wanted you to focus on what is the one, just get one good area working. A lot of facilities started out with UTIs, and I know we track, you know, all infections, but they really wanted a process involved, and they really, a lot of homes stressed of the UTI area because it's so common and such a big issue in our facilities. System of tracking, system of reporting, and then education, and making everyone aware of what the issue is, so that everyone's constantly reminded of what's going on. Okay, I'll wrap this up with some of our key points to remember. Next slide, please. Antibiotic resistance is not going to go away. It's sort of like COVID-19. I wish that it was, but it's going to continue, and it all has the appearance that it's going to continue to get worse. Proper use should be implemented and encouraged for antibiotic stewardship, and monitored to make sure we're using the right drug, the right person, the right dose. Core elements focus on involving awareness among all staff and disciplines. And of course, our goal is healthier residents, co-workers, and family members. I've left you just some resources that on the next slide that you can look through. I just wanted to leave a reminder that some good information. The antibiotic use in the United States, CDC put out an update in 2020. Some really good information on where we are as kind of in the middle of that pandemic. Antibiotic research, a lot of the information I got for some of my statistics was from Clearview Health. Most facilities are aware of the Nursing Home Infection Preventionist Training course at the train.org. It's a collaboration with CMS, and I believe Health and Human Services put that together. I know several that have gone through that program. They tell me it's rather slow, but very informative. And then I've listed some TMF resource that's particularly helpful. They have a QI offering that I'm sure Susie can help us out with. Thank you, Dr. Ross.
Thanks so much. I'll actually hold questions till after Susie, so we'll pass it to Susie and then have some discussion. We'll get her PowerPoints up right here. I appreciate the resources. Definitely good to have. Okay, go ahead, Susie.
Great. Thanks so much, Dr. Ross, and thanks, Ken. You know, it's always great to hear about these things. I sort of echo the challenge that I think everyone is facing with sort of managing through, you know, all of the COVID implications and sort of refocusing in terms of antibiotic stewardship. But it's one of those things that it's really important to just stay on top of and continue to look at and track and monitor. So we're going to talk a little bit about how to review your existing program, as well as gain a better understanding of the antibiotic use in your facility. So let's go ahead and go to the next slide, please. So here are just a few points that we're going to cover today. We're also going to just share some tools as well as resources that can be used. You know, again, as Ken mentioned, sort of tracking, reviewing, and reporting on your program is really, really important. So we're going to kind of walk through exactly how to do that this morning in a really simple, sort of straightforward way. So let's go ahead and go to the next slide, please. So Ken mentioned earlier in his part about the core elements of an antibiotic stewardship program, and you'll see them here on the screen. I'm not going to go into these in any great detail, but really in terms of a starting point to sort of figure out where your facility falls. And again, this is a good time to kind of circle back to this. You really want to start with these core elements. The CDC has developed a checklist, and you see sort of an image of it there on the screen. And this really can help you to kind of run through your program really quickly. It's about a 3-page checklist. It's really straightforward, really well organized, and it just basically asks you a few questions within each of these categories. And so an example would include, under the actions to improve use category, the checklist would ask you if you have a facility-specific algorithm in place for assessing residents, if you have an algorithm in place for appropriate diagnostic testing, if you're doing antibiotic timeouts. So, it kind of asks you those questions, and you can very easily go through and sort of figure out where your program is at this time. So another example is in the tracking section. It asks if your facility is monitoring antibiotic use and resistance. So again, this is a great place to start. It's really easy. It's really straightforward, and will give you a great sort of baseline assessment for where your organization stands. So let's go ahead and go to the next slide. Once you kind of have that basic understanding of where your facility stands, you really want to have sort of a discussion with your QAPI team, share those results. You really want to think about emphasizing those elements that are going really well within your facility. You also want to think about those areas that might be challenging. You want to think about why they're challenging, as well as why they're kind of difficult to implement for you. And then finally, think about where the opportunities lie. And again, I think we talked about this a little bit last week, but when I was a director, I always tried to sort of jump in and tackle something that was relatively straightforward and relatively easy, but also had a lot of bang for the buck. So in terms of prioritization, that's kind of how I did it. But it is really a good idea to sort of start with one area. That way your team won't get overwhelmed, and hopefully you'll gain some early successes and early wins before you try to tackle the next one. Okay, so let's go ahead and go to the next slide. So as you're digging a little bit deeper in terms of looking at antibiotic use within your facility, again, I try to make it really simple for folks. I know we don't have a lot of time. You just might want to consider these very simple questions. These can also be used to help you to think about what data elements you might want to think about sort of gathering. So considering who is prescribing the antibiotics, what the most frequently used antibiotics are, where are the areas in your facility that tend to use the most antibiotics, when are the times that they're most likely prescribed, as well as why they're being used, or what are the most common reasons they're being used. And this can really provide you with the basic framework that you need to begin sort of thinking about a long-term plan for antibiotic use. Okay, so let's go ahead and go to the next slide. So Ken mentioned how important it is in terms of tracking. So really, this will help you to better understand the antibiotic use within your facility. This is just an example tool. This tool is available from HRQ. You may have an internal tool that you use, but really what you want to look for in a tool is that it brings together all of the data that your team needs about infections, lab results, x-rays, types of organisms, names of prescribing clinicians, any sort of antibiotic therapies, and just making sure that it's also sort of tracking up the communication elements. So any sort of follow-up communication with residents, as well as prescribing clinicians. And that will give your team really everything you need in one place to make some good decisions. So in terms of a process, it's great to have sort of a designated person responsible for completing this element. We always want to make this really easy for our nursing team. We want to make sure that they have an easy way of reporting the information that's required. It's great to do this on a weekly or a monthly basis. And then you can use this to really kind of create some of those more trended reports. So looking at monthly, quarterly, or annual cumulative reports. So again, this is just a great way to bring all those data pieces together in one place to make sure that your program team can see any sort of trends as well as patterns that are happening within your organization. Okay, so let's go to the next slide. So another great way to sort of continue to understand what's going on within your home is to perform a chart review. I think you all are probably pretty familiar with this. Again, this is a tool that you can use to do that. It's pretty straightforward. In terms of process, you just select a sample of charts from patients with recent antibiotic use, either current or in the past month. And then you want to look at the antibiotics that have been initiated within your facility. So if a resident has multiple courses, you can really kind of just review the most recent course. So again, just for each chart reviewed, you answer the questions. Like I said, really straightforward. This can also give you a great sense in terms of just in time, sort of looking at what's going on, to really give you a sense of kind of what's going on. All right, let's go ahead and go to the next slide. So Ken mentioned as well the importance of having monthly reports. So again, this tool is from AHRQ. It just has the suggested categories of information that you really want to sort of think about tracking and trending on a monthly basis. So again, this is just an example. This might be a good place to start, and then adapt these based on what your program team identifies as the goals of your facility. But basically the key elements here are to be able to see really a month-by-month comparison. So you want to look at totals over time. You want to make sure that your program team can assess if the usage of antibiotics is increasing, decreasing, or staying the same. So, so again, this just gives you, your team, a really great way to measure your progress. Okay, so let's go ahead and go to the next slide. So just in terms of key points, really, and just to summarize, you know, it's really important to remember that the entire nursing home team really has to work together in terms of thinking about antibiotics, understanding how they're used and how they're prescribed, and really preventing antibiotic resistance for our residents. So just making sure that we're tracking and trending how usage is increasing or decreasing, and making sure that we're always documenting everything so that we have that information. You know, and again, it's always a great idea to engage families and residents in this journey, making sure that we always have sort of a patient-centered approach. Okay, so on the next slide are some key questions that you might want to think about just as you continue sort of down this journey. And this is a great way to kind of just ask yourself some questions and sort of think about what's going on with your organization. So the first question is, how often do you review your antibiotic stewardship program? How do you communicate to staff and providers that antibiotic stewardship is a priority? And finally, thinking about how you engage families and residents in this process. Okay, so just some thoughts to sort of leave you with as you begin to think about antibiotic stewardship. And on the next slide, there are a few references. I think I went ahead and included the additional links to the tools. We have a link to the TMF website, as well as some other great resources. So thank you all so much for listening today. If you have any questions, you can always feel free to reach out to the team. And with that, I'll go ahead and turn it back over to the team for our breakout. Thanks, guys.
Thank you. Thank you. Before we go to our breakout sessions, are there any clarifying questions on the content that was shared? Again, I appreciate all of the